Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 14 new cases, but due to a data cleanup completed yesterday, our net increase is 2 cases for Windsor-Essex County. 2 are close contacts of confirmed cases, 5 are community acquired, 1 is outbreak related, and 6 cases are still being investigated. We have had 16,592 cases since the beginning of the pandemic. 165 people are active at this time, with 91 of our active cases being a variant of concern. To date, 1,818 preliminary or confirmed variants have been identified in Windsor-Essex County. We are now following the World Health Organization's nomenclature and using the Greek alphabet to identify the variants. 1,681 cases have the Alpha variant, formerly known as the UK variant. 6 cases have the Gamma variant, formerly known as the Brazilian variant. 4 cases have the Beta variant, formerly known as South African. 1 case has the Kappa variant. This is one version of the Indian variant. And 1 case is the Delta variant, which is another version of the Indian variant. 13 people are currently in the hospital and 5 people are in ICU. Our community has lost 427 people to COVID. There are currently 7 active outbreaks in Windsor and Essex County, 6 workplaces and 1 in the community. Regarding the vaccine update, 285,359 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 253,255 people have received at least 1 dose. So right now, overall, 71.7% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. 9.5% of our adults 18 years of age and older have received both doses. Residents that are 12 years of age and older of Windsor-Essex County are able to book their vaccine appointment at one of our mass vaccination sites. Seniors 80 years of age and older are able to book their 2nd dose at one of our mass vaccination sites. We continue to ask family and friends to help your loved ones book their 2nd doses. You may book your appointment at wevax.ca or call 226-773-2200 if you need assistance. People are also able to receive their 1st dose of vaccine at a participating pharmacy or primary care provider. Select pharmacies continue to offer 2nd doses of AstraZeneca. Please visit wechu.org for a list of pharmacies. Today, another pop-up clinic will be held for youth and their families at the Essex Centre Sports Complex in Essex from noon until 7 p.m. If you do not have a copy of your vaccine receipt or a record of your vaccine and would like one, you can log on to ontario.ca's portal and download a digital copy. This link is also posted on our website. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Just want to reiterate the importance of public health measures, and despite the net increase of 2 cases in our community, this is just a 1-day number, and we know things change. So please continue to follow those public health measures until we see a consistent decline in the cases. We have been seeing some decline in the last week or so we'd like to see that trend continue. Please follow the public health measures before we get to any stages of reopening and to get back to our normal. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Yes, good morning. I wanted to ask about the provincial announcements surrounding AstraZeneca and how people can get a 2nd dose of a different vaccine now if they choose. What is the instruction for local residents who might be wanting to pursue that path?
So I'll start, and maybe Teresa can add in the end as well. So basically, just like we said last time, for people who have received AstraZeneca, they have 2 options. One is they get their 2nd dose of AstraZeneca through the participating pharmacies and complete the series with using just the same vaccine. With the updated guidance from Massey and further operational details from the province, anyone who is interested in receiving an mRNA vaccine as a second dose if they've received the first dose at AstraZeneca, they can start booking the appointment starting June 7th, and then they will be part of that system of available appointments, but they have to be at least 12 weeks interval from the first dose of AstraZeneca.
Thank you. Do you have a sense of how many people might be making that switch? Do you have a sense of what the interest might be there?
Well, it's hard to get the interest because when you have more options, people sometimes tend to choose the option that's more convenient for them. We have distributed at least 37,000 doses of AstraZeneca in our region, which really helped us to contain the spread of COVID in our community. And right now, even let's say if 50% of them choose to take an mRNA vaccine, that means 18,000 more people who will be receiving the Pfizer or Moderna vaccine. So there are, we're talking about a large number of people, and I can't predict which way they will go, but I anticipate that at least more than half of the people will opt to continue with the current vaccine that they have received. But I could be wrong. We'll have to wait and see.
Thank you. One more question. There's been this idea floated recently about in-person outdoor graduations. First of all, what do you think of that idea from a public health perspective? And also, would the health unit need to sign off on those kinds of plans?
So we, just like you, I've heard that through the media, that this is what's being contemplated. We have a very strong working relationship with our school board. We work with them very closely, so we'll be connecting with them to see how they're thinking of operationalizing it, and if this is a direction from the province that everyone have to do it. So they'll probably develop a plan, not necessarily thinking that there will be a sign-off requirement, but obviously there will be consultation on that. And we'll have to wait and see the details that would come out from the province.
Thanks very much.
Any questions from CFTV?
No, thank you.
Any questions from Blackburn?
Yes, just to follow up on some of the previous questions. Now that the province has come up with guidance that says after the 12-week interval, people who received first received AstraZeneca can get the Pfizer or Moderna, will they be able to sign up through the health unit's website, or will they have to go to a pharmacy to get that second shot if they choose to get a Pfizer or Moderna?
So they will, according to the ministry, they'll be able to get the Moderna or Pfizer at pharmacies if they're giving it as well. But they will be able to, as of June 7th, we're working on our booking system, and they'll be able to book that second shot through our booking system. So we'll create a pathway for people that received their AstraZeneca first dose. 12 weeks, the interval will be very important, and they'll be able to book that second dose of a Pfizer or Moderna on our, at one of our mass vaccination clinics.
I'm not sure if you're tracking this, so you could answer this, but do you have an estimate of at this point, the percentage of appointments that are going for first doses and the percentage that are going for second doses?
I don't have that offhand, but I'm just trying to think of what week we're in here. So yeah, we're at the beginning of June. So the second doses are basically being completed for 80 plus, because that's who we started with first. And we know that we were looking at about 15 to 16,000 of people that are 80 plus. So we'll have to look at that, but we continue to do a good amount of first doses because we're working on the youth that are 12 to 17 years of age. And as of yesterday, we had a third of the youth completed from that age group. And so we continue to do first doses for that age group and anyone else that hasn't received their first dose. So we're not really into the area of a lot of second doses until later on in the month of June.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. I know I ask this most days, but have you received an update from the ministry on when more doses of AstraZeneca will be coming?
So today we will finish our deliveries to the pharmacies, and we know that at the end of today, that we'll have another 5,000 doses that were in our community to the pharmacies for AstraZeneca. Other than that, we haven't received any further information about that, but we know the ministry has asked for our total allocations that we've delivered, and so right now, as of today, there is about 5,000 doses of AstraZeneca in Windsor-Essex County for use by the pharmacies, and we'll await more vaccine coming to our area, but I don't have that, any confirmation.
That 5,000, is that in addition to the 4,500 you've spoken about before, or is that around the same number?
So these are, the ministry provided about 200 doses that are being distributed to 16 of the pharmacies, so that would be in addition.
Okay, and based on the announcement today, is it possible that some AstraZeneca recipients may not be able to book appointments at the 12-week interval, that they, by the time that they're eligible, might be the 13 or 14-week mark for them?
That could be the case. I'll let Dr. Ahmed comment about that, but that could be the case.
Yeah, so, and to build up on that, especially with AstraZeneca, Taylor, and I've said this a few times, that this particular vaccine, the way it works, delaying the dose up to 12 weeks, it basically helps to boost the response. So it's not necessarily something bad if someone is receiving the vaccine after 12 weeks, because we already had a decision to give the second doses of AstraZeneca after 16 weeks. So we're still in this in the effectiveness zone. We'd just like to make sure that once we have the vaccine supply, can we give it out to the people who are looking for it? So short answer, it's not necessarily a bad thing. So if they're not getting their vaccine before they complete their 12 weeks, they don't need to panic. It may in fact could be a good thing and have a better immune response rather than any concerns if it's delayed for 13 weeks or 14 weeks.
Okay, that optimal immune response is just at 12 weeks or later?
Well, 12 to 16 weeks is the timeline that we are looking for.
Okay, and to be clear, the WeVax pathway for second doses for AstraZeneca who want mRNA, that will open up on June 7th?
Yes, so we, just received the confirmation from the ministry, and the provincial booking system will open on June 7th and will align with the provincial booking system. So we'll aim for that as well and create that pathway.
Great, thank you.
Any questions from AIM 800?
Sorry to likely make you repeat yourself here. Just going off of Taylor's question about the number of AstraZeneca doses. So by the end of this week, how many doses will be available to be distributed in Windsor-Essex?
So as of today, I know that we have an additional 5,000. I am going to pull up the report that I have. So we had yeah, I'm just trying to look at, all I know is that the new allocations that we received yesterday were 200 doses for 16 pharmacies that we're moving forward. Shoppers and Loblaws are receiving their ministry allocation directly from the ministry, so they haven't received theirs yet. So at this time, I only know what we have received and distributed. So we anticipate more AstraZeneca coming to our area, and but right now, as of today, we went from about 1,577 doses in our area, knowing that many of that was, much of that vaccine was already taken for and gone. To today, we'll have 5,058 doses available. So that's what I know
Okay,
today.
thank you.
Yeah, that's what I know today, knowing that Shoppers has not received their doses because they're getting them directly from the ministry. So I can only comment on what we've received. And then we have our EPI, he'll pull all of that, for the report tomorrow. But he'll pull it all in COVAX. As long as everyone's using COVAX, we'll get all that information and have more accurate information in COVAX.
Okay, yeah, so I just want to make sure I'm clear in what I write today, so I can say that the health unit as of today has 5,058 available doses that they'll be distributing, but pharmacies are getting doses directly from the province, not through the health unit.
Yes, the Shoppers pharmacies are getting it directly from the province.
Okay, thank you.
Any questions from CTV?
Yes, good morning. Sorry, can you clarify the data cleanup issue? Are there 2 new cases or 14 new cases?
So we have 14 new cases today, but it in the overall numbers, it translates into just an increase of 2, and that was due to data cleanup that occurred yesterday. But according to our EPI, we have 14 new cases. I don't know exactly, or is that? I'll let Dr. Ahmed comment.
So when we're looking at these cases, obviously we get notification of these cases of how each of these positive and negative cases, and then we try to go back and look into our existing database to see if any of these cases that we have already counted in. So all these, out of all these cases, the net increase is only 2 cases, despite the reporting of however many cases. So not to confuse people, all those cases we have already tracked down. We've already been following up. So it's not necessarily adding to the existing number of the cases. So the net increase for our for today is just 2.
Okay, that explains it. Thank you. Now, Doug Ford had indicated yesterday that the province might move into step 1 sooner than July 14th. Given our declining case counts, do you think the region is ready to begin gradual reopening?
Well, I think looking at our case rates locally, I think we can, but I just want to be cautious in terms of how we are moving forward. And as we have seen in the last 2 weeks or so, the numbers are definitely improving in our region. But we know that there are other variants that are coming into the play as well. So looking across the province, that there are other variants that are getting foothold in Ontario, and it can change. So we are doing a good job in terms of vaccine coverage rate and vaccination across Ontario, and which is a great thing. And especially in our region, we are getting a very good coverage rate. So overall, it looks good, but I just don't want us to be, moving forward too quickly. We'll see. We'll welcome any opportunity to open up, but we just want to make sure that it is done in a safe way without putting the community at risk.
Okay, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from CFTV?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yeah, sorry, Teresa, to make you go over this again. So 5,058 doses will be available, and that's on top of 1,577 doses, not on top of about 3,000 or so from prior.
So the 6.
I'm trying to reconcile, because previously you mentioned about 12,000 at 1,200 at first, then 3,000, then a total of about 4,500. So, just sorry, could you reconcile those numbers for us?
Let me just look at, yeah, I know, I feel like it's confusing.
Maybe we can circle back later.
Yeah, I might have to check all that because we have not received all of the AstraZeneca that we anticipated. And I think we're at a total of 5,058 in total that we've received, but let me check that. But then that's not, I have to check it because it's not adding up. When I'm just looking at it right now, I'm like, this doesn't seem to, there should be more out there than this. I'm looking, let me just see.
I appreciate it. I mean, as you know, we're getting messages from people who want their second AstraZeneca dose, they can't find it. So just to know how many are actually, how many have been given out, how many are coming, we'd appreciate it.
Yes, and based on what I'm looking at today for June 3rd, it looks like there's 5,058 doses in our community for distribution. So that would be on top, but I want to check it all out and then we'll have Mike send an update about the AstraZeneca. We were working on this yesterday and didn't complete it because things are changing all the time, but let us get a better handle on that and share that with you.
Thank you.
Any additional questions from AMA 100?
No, thank you. I'll just be waiting on those AstraZeneca stats as well.
Okay. Any additional questions from CTV?
No, thank you.
Okay, thank you, everyone.